Hi, my name is Issam Turk. I'm a gastroenterologist here at Monument Health, and I'm a general GI physician. I always knew I wanted to go into medicine, and I knew I wanted to go into internal medicine because through internal medicine you can subspecialize. I didn't have any specific interest in GI at the time, and I was kind of thrown into it, and I fell in love with the field. I really enjoyed the procedures. I liked the intensity of it. Being able to witness that and see a patient who's crashing and being able to save their life is very gratifying. So being exposed to that in the ICU, on the regular floors, and then also in the outpatient setting, I thought it was very interesting. And like I said, the field of GI is very broad. There's a lot more to gastroenterology than what the average person knows. My philosophy, it varies depending on whether I'm in the inpatient setting or in the outpatient setting. Of course, in the inpatient setting, you're dealing with acutely sick patients most of the time. It's more direct, it's focused on getting the patient better fast. Situations vary where sometimes it's urgent or emergent. When it's an emergent situation, such as someone having a massive bleed, whether it's from an ulcer or what we call esophageal bleeding, then you just get straight to the point and you try to save the patient's life. And then other times in the hospital, they could be presenting with things like acute diverticulitis, infection in the colon, and that also can be complicated or uncomplicated. And you talk to the patient, you explain what's going on, you have more time to explain what's happening and formulating a proper plan. In the outpatient setting, my philosophy, my approach is different. It's individualized and it's personalized on each patient because every patient reacts differently to different disease. I first like to assess what the patient understands or what they know about their condition, what diagnosis they may or may not have been given. I'm kind of old school in the sense where when I go into a patient's room, I do not like to use the computer or anything. I like to engage with the patient, and I do my pre-charting before. I spend my time during the encounter engaging with the patient, listening to them first, and then we formulate a plan, an assessment together. When it comes to the outpatient setting, which is primarily what I do here at Monument Health, I like to have this direct communication with the patient, try to keep it as personalized as possible and give them all the attention that they need. And my goal at the end of the encounter is to make sure that the patient understands everything that's going on as much as possible. And I give them plenty of time to ask any questions and make sure that everything's clear. And what was unique about this institution is the leadership. They are very approachable, they're very humble. They work with the physicians. I was really impressed by how the leadership is here at this institution. They really do care about patient outcomes. So I felt that it was genuine, it was real, and that's really what pulled me here. So I was born and raised in Beirut, Lebanon, and we moved to the US in 2001 with my parents and my two younger brothers. And we grew up in Michigan, around Metro Detroit. 15 years of my life I was in Lebanon, and then the rest of my life I was in Michigan, and now we're here. And I'm here now with my wife, and we got two little ones. We have a 3-year-old girl and a son who turns 1 this weekend. Really, whatever free time I have, I like to spend with family. And now that we're here in Rapid City, once the weather gets nicer, I really want to explore the outdoors, get into fishing and hiking, etc.